Centers for Medicaid and Medicare Services has agreed to expand Medicaid services to the Philippines and other areas outside the U.S. Governor Calvo made the announcement this morning at a ceremony signing an MOU establishing a sister city agreement with Philippine Governor Armando Espino Jr. of the Pangasinan province.
For so many years, many of our people that are insured would go to the Philippines for quality health care at many of your health institutions out there. The unfortunate thing is, for many of our people that cannot afford health care, those that are in our medically indigent program, Medicaid, they have not had that option. And I'm here to make an announcement. I want to thank the hard work and efforts of our Congresswoman and working in Washington, D.C., as well as support from our legislators.
The change will happen once the Guam Medicaid program amends its state plan. The conditions under which Medicaid services may be covered include emergency or medically necessary services not available on Guam. The out-of-country provider must be the nearest source of care. Foreign countries must be JACO certified, and foreign providers must have a signed agreement with the Medicaid agency. According to Healthcare Committee Chairman Senator Dennis Rodriguez Jr., it's definitely good news, but efforts are also focused on similar designations for Medicare, which is designed to help with long-term care for the elderly.
The ultimate goal here is to get our manamko who are under Medicare, and this is an issue that even my office has been pushing very hard with the Congresswoman's office, and also ultimately it'll be the federal government who would approve this. But at the same time, this is something we need to make sure we work with our local physicians, providers here, because there's always been that concern that we're taking our services and shipping it out somewhere else. And the governor made it very clear, and I thank you for making very clear, is that these are for services that are not available on Guam, which we all know there's a lot of services that are not.
Congresswoman Berdalio, meanwhile, commented that coverage of certain Medicaid services outside the U.S. is already covered in other places. This change to Guam's state plan brings it up to speed with other state policies and allows the Guam Medicaid program to begin using this option.